Welcome back Sunbro. We hope you're all in great health and great money. Today we are going to talk about understanding cytokine storms that instantly take lives. An intricate mechanism makes up the human immune system. Immunity has always been viewed as a good quality that shields the body from many diseases. It should be highlighted, nevertheless, that immunity can covertly become a boomerang that kills patients, even COVID-19 patients. What exactly is a cytokine storm? An immune system overreaction known as a cytokine storm occurs when the body rapidly releases an excessive amount of cytokines into the bloodstream. Immunological proteins known as cytokines are key players in the body's immune response. In reality, cytokines are good proteins. However, if a big amount is released all at once, the body may get inflamed and slowly deteriorate. A cytokine storm's telltale signs and symptoms. Cytokine storms can be brought on by a variety of disorders, including infections, autoimmune diseases, and the side effects of some immunotherapy treatments. Symptoms of a cytokine storm including high fever and chills, inflammation that manifests as body edema and redness, fatigue, nausea and vomiting very badly, joint and muscle ache, rash, headache, cough, difficult to breathe, short breaths, seizures, difficulty controlling physical movements, hallucinations and confusion, poor response. Cytokine storms can sometimes be fatal and result in the collapse of several organs. Hypercytokinemia is the medical term for organ failure brought on by a cytokine storm. Why do cytokine storms occur in corona patients? The SARS-CoV-2 virus that produces COVID-19 also has to be watched out for because it frequently induces cytokine storms in patients, which is concerning in addition to the mutation instance. In actuality, a cytokine storm is most likely to blame for the increased mortality rate among COVID-19 patients. As is well known, the coronavirus can proliferate rapidly once it has infected body cells. This condition causes the cells of the body to become stressed in an instant due to the high quantity of viruses that enter. The body's cells start to emit alarm signals, and they then commit suicide as a result. This is carried out as a defense mechanism by the body to prevent the virus from infecting additional cells. But because there are so many stressed and dying cells, a lot of body tissues are dying violently. In the case of COVID-19, the lungs are where this tissue loss primarily takes place. The air sacs in the lungs leak and fill with fluid when lung tissue is injured. Additionally, there is a sharp decline in blood oxygen levels, which causes the patient to become fatigued. A cytokine storm's effects also result in severe respiratory distress and other organ failure, ranging from heart enlargement to acute renal failure to brain encephalitis. The patient's life can be taken in an instant by the deadly impact of this cytokine storm. How to manage a body's cytokine storm. Supportive care is crucial if the patient is going through a cytokine storm. Patients typically receive a variety of treatments in the ICU, including checking vital signs carefully, installation of ventilators, liquid infusion, electrolyte administration, dialysis, hemodialysis, administration of medicines to decrease the activity of cytokine proteins. Each patient's condition will also influence how cytokine storms are handled. The patient will be given medications to battle the bacteria if it is a bacterial infection. Treatment for a cytokine storm brought on by COVID-19 may involve a number of treatments administered simultaneously. Tocilizumab, Actemra, a medicine routinely used to treat the symptoms of rheumatoid arthritis, can be relied on to inhibit the activity of the cytokine interleukin-6 IL-6. Actemra has been utilized to treat the cytokine storm, a side effect of leukemia therapy, because of the way it functions. The probability of recovery as a result of a cytokine storm will vary greatly depending on the patient's condition. Handling cannot be random. It must be quick and accurate in accordance with the patient's needs. The likelihood that the patient will survive the body's cytokine storm increases with how optimally the treatment is given. Thanks for watching Sunbro. Please subscribe, like, comment, and share if you find this helpful. Come again to our next meeting Sunbro.